When food is ingested, it travels along the digestive tract, where it is broken down into its component nutrients in order to be absorbed into the bloodstream. One such nutrient is glucose, a simple sugar. Glucose gets absorbed by the stomach and intestines and then enters the bloodstream. It travels through the circulation to all body cells. Once absorbed into the bloodstream, glucose circulates, causing the blood sugar level to rise. An increased level of blood sugar sends a signal to the pancreatic beta cells, which respond by secreting the hormone insulin into the circulation. Insulin is necessary for glucose to reach and be used by several important target tissues throughout the body. These include the liver, muscle, and adipose tissue. Insulin is necessary to keep blood glucose levels stable in the body. Glucose enters the cell through a process called facilitated diffusion.
Diabetes. You are not alone. Millions of people today have diabetes. Diabetes cannot yet be cured, but it can be managed. This video will give you some tips to help you manage your diabetes. Diabetes is a condition in which sugar levels in your blood are high. When you eat, some of your food is broken down into sugar, also called glucose. Sugar travels in your blood to all of your body's cells. Why is insulin important? Insulin helps sugar move from your blood into your cells. Insulin is a hormone that is made by beta cells in your pancreas. Cells in your body need sugar for energy. Sugar from food makes your blood sugar levels go up if it cannot get into the cells. Insulin made by beta cells lowers your blood sugar levels by helping sugar move from your blood into your cells. In addition to insulin, there is also another hormone made in the pancreas called glucagon that tells the liver to release stored sugar if your blood sugar gets too low or if you have not eaten for many hours, such as overnight. What other hormones are involved in diabetes? When you eat, another hormone made in the gut helps the pancreas produce the right amount of insulin to move sugar from the blood into the cells. This hormone is called glucagon-like peptide 1, or GLP-1. One of its primary actions is to stimulate the beta cells in the pancreas to produce insulin when the blood sugar is too high. It also helps to lower the amount of sugar made by the liver. What happens in diabetes? The most common types of diabetes are type 1 and type 2. In type 1 diabetes, the body makes little or no insulin, so people with type 1 diabetes must take insulin every day. Type 1 diabetes is usually diagnosed more often in children and young adults. In type 2 diabetes, the body prevents the insulin it does make from working right. The body may make some insulin, but not enough. Most people with diabetes, about 90%, have type 2. This kind of diabetes usually happens in people who are older or in those who are overweight. What causes type 1 diabetes? Even though the exact cause is unknown, in type 1 diabetes, cells from the body's immune system attack the insulin-making beta cells of the pancreas. Without symptoms or pain, over a period of months or years, the beta cells are killed. As a result, the body does not have enough insulin. Normally, insulin helps the cells of the body take sugar out of the blood. Cells use the sugar as fuel. Insulin, sugar builds up in the blood. This can harm blood vessels. It can also cause heart disease, blindness, and kidney failure. To keep these things from happening, people with type 1 diabetes take insulin several times daily. Most people with type 1 diabetes are diagnosed around the age of 12. What causes type 2 diabetes? In type 2 diabetes, the body either does not make enough insulin or is not able to use it properly. Type 2 diabetes usually begins with insulin resistance. This is when the cells can't use insulin properly. As we explained earlier, insulin is a hormone made in the pancreas, a gland near the small intestines. Special cells in the pancreas, called beta cells, make the insulin. The body constantly checks how much sugar is in the bloodstream. When blood sugar levels rise beyond a certain point, the body signals the pancreas to release insulin. Insulin helps the cells use sugar. The diagnosis of diabetes is given when not enough insulin is available, either because the pancreas can no longer keep up with the demand or because the body can't use the insulin that is produced. Let's take a closer look. Cell walls have little locks called receptors. Insulin fits into those locks like a key. When insulin opens the locks, sugar is allowed to enter the cells. When the body is not able to make enough insulin, blood sugar is locked out of the cells. Sometimes the locks change in shape. Then the insulin can no longer fit into them. Either way, blood sugar is locked out of the cell. It stays in the bloodstream and can become too high, causing hyperglycemia, which can lead to the symptoms of diabetes. When cells cannot get sugar, they no longer have the fuel they need. The pancreas tries to make up for this by working harder. At first, the pancreas keeps up by making more insulin. In time, the pancreas is unable to continue doing this, which is when the symptoms of diabetes may appear. As a result of these changes, your physician may discuss starting a diabetes care plan with you. Diabetes care plans can include taking diabetes medicines, eating a carefully planned diet, exercising regularly, controlling blood pressure and cholesterol, and possibly taking aspirin daily.